Beginning January 1st, you must have health insurance. Minnesota is taking the lead on offering health insurance that can be purchased online through what is better known as an exchange. It's supposed to be a one-stop shop for purchasing your health insurance, and Minnesota Management and Budget Commissioner James Showalter joins me right now with an update. Thanks for joining us.
Pleased to be here.
So, Commissioner, let's begin with that. Can you update us as you can on this ongoing process, including the development of the website and the selecting of those insurance products?
Sure. It's an exciting project. It is really trying to address our insurance market and how you buy and access insurance so that people can shop, choose, and purchase insurance all in one place, whether you're working for a small employer, whether you're an individual looking for insurance, or whether you're potentially eligible for public programs. So we've got state employees, IT vendors, local units of government, and health carriers all working towards the same end to make this a reality.
I'd like to pose for you some of the questions that I've heard from some people, including some of my friends. And one is, what if you have a large employer and you have employer-offered health care? Can you still opt out of that and purchase through the exchange instead?
The exchange is really part of that broader Affordable Care Act set of changes at the federal level. And the marketplace that we're setting up, the exchanges, is really designed and geared towards small employers and individuals at this point. That's what the ACA is designating for the marketplace at this initial stage.
Another question that I have heard, it might be a little simplistic, but I've heard it repeatedly, and it was essentially, could MNsure result in Minnesotans picking up millions in unexpected costs? Say if enrollment is down or you find technical issues, could it cost a lot more than what's budgeted?
Really what the legislation that authorizes the state-based exchange does is says, to the extent it's successful in selling insurance, we will be able to get revenue off of the insurance that's sold. To the extent it doesn't sell insurance, well, then the costs are going to have to shrink on the exchange. So it is not a matter of the state putting money directly into the exchange. It's really a question of how much will this address some of the questions that we have in our health care marketplace. And that's a question that the federal government is trying to figure out as well.
And there are a lot of unknowns here, and you spoke briefly about some of those products that could be available. There have been questions about what the products will be and the cost, and state law apparently dictates that information can't be released until October 1st. So how could this and will this affect the whole process?
Healthcare reform is such a big topic that it includes so many things, whether it's regulation, public health programs, the marketplace itself, public programs, many different pieces are changing all at the same time. So yeah, you're right. How rates are going to change is only known by the Department of Commerce right now. And until their review is complete and that becomes public data, I don't know, the exchange doesn't know, that's still under process. I think the key thing that other states are finding, where the state law says it is public data, because it's private data based on state law, is that what you see as a price change depends on where you're sitting and what your current markets are. So, for instance, if you can't access insurance right now, well, insurance is going to come down significantly because you can access coverage. If you're in a small group that has no illnesses, you might have relatively low-cost insurance, but you might find that your pool, your risk pool, is the whole population now, so you might see some increases. There's going to be differences across individuals, and it's going to take a while, I think, for the whole market to get to a new place and understand sort of how we can slow down healthcare insurance and costs and healthcare cost growth, because that's really what we're all after.
I'll try not to ask you any more questions where you sigh at the beginning. But to delays and change, do you think any of the delays and the changes that are happening at a federal level, are they going to impact what happens with this exchange?
The exchange is part of a nationwide set of exchanges set up in every state. And our marketplace is going to be state-based, so it's going to be based here in Minnesota. It's going to be based upon legislation that the Minnesota State Legislature passed. It's going to work with our regulation as well as the information that we have. Not all states chose that option. Some said, well, we want a marketplace that's based upon a vanilla product that the federal government will stand up and offer in other states. They'll have less choice, less information, and their costs actually for running the exchange will be probably higher than what we're going to experience in Minnesota. So there will be stories coming across the country about good things, bad things, questions, turmoil as these exchanges are created and start to operate. All of them are related to that same federal legislation, but each of them may have different implementation issues.
Let's talk about some of those implementation issues. This thing launches October 1st. Do you anticipate, in the hearing today, Representative Diane Loeffler said that this is essentially a brave new world. So do you anticipate a lot of glitches, surprises? What's the feeling going into this right now, knowing we're just a few months away from launching?
Yeah, I think her comment is appropriate. It is a significant set of changes in how people access insurance. And insurance isn't simple. It's very personal. It's very important to people's feeling of security. And so we will be working out an IT system, a business process system, but also just relationships and communication so people understand how to get insurance. So that means working through community groups, and contracts will soon be signed with local nonprofits to help people understand what's happening in the insurance marketplace. It'll be working with brokers who have long-standing relationships with businesses or individuals. It'll be working with the business community at a much higher level. All of these things are going to be happening, and as you well know, communication doesn't happen instantaneously. It'll take some time.
You just stated insurance isn't simple. I think that's a very fair statement. I just logged on though to the MNsure website, and to me it looked amazingly simple. So if people get frustrated, do you anticipate them getting frustrated? And more importantly, how will they know who to contact to kind of work through all of their concerns with?
Great question, because one of the primary reasons and things that we want to accomplish in our Minnesota marketplace is have one door for people to open to find out what kind of insurance they might be able to afford, what kind of programs they might be eligible for, and have one source of information to compare what they could access. And so we will have a central call center. We'll have marketing plans out there so people can understand exactly how to contact them via the web, just a simple phone call, other ways, but to have that kind of responsiveness in one place where they could find the expert who can answer their question. And if they can't, they will hand you off, even as they're on the line, to another person who hopefully can. So we want to make sure that customer experience is as positive as possible. And again, that's something we'll be learning and developing and working towards starting October 1.
Okay, Commissioner James Showalter, we hope to have you in maybe after the first week of October, and we can analyze the success. Thank you very much for joining us. We appreciate it.
Thank you.